Heather Reneau. I'm the Senior Administrator for the Belize Cancer Society.
Good morning, Ms. Heather.
Good morning.
This morning we are here from the Tosayola Public Library. We would like to ask you a couple questions in regards to cancer awareness. We know that this month is Cancer Awareness Month, therefore we have some questions that we would like to shed some more light on. So my first question to you this morning is, what is breast cancer?
Okay, we're happy to be supporting the library and in getting the education across. And breast cancer is a very, very important cancer, especially for us here in Belize. Breast cancer is simply a disease where the cells in your breast grow out of control. Now, there are different types of breast cancer, but the types of the breast cancer depends on what part of the breast the cancer starts to develop. So here in Belize, we have been having a significant rise in breast cancer. Unfortunately, nobody knows the exact cause of breast cancer, but there are different risk factors that put you at risk of developing breast cancer. So we have a lot of obesity in our community, and obesity has been linked to breast cancer as one of the leading causes of women getting breast cancer. And it has been linked to the reoccurrence of women who have survived breast cancer, that it reoccurs later in their life, and it has been linked to obesity as well. Another risk factor for developing breast cancer is women that drink a lot, if you smoke a lot, if you have a hereditary of breast cancer, the type of foods that you're eating, the lack of exercise. So breast cancer and cancer alike is part of what we call NCDs. These are non-communicable disease, but most of them share the same risk factors: the lack of exercise, the unhealthy diets, the lack of sleep, the stress. So these are things and lifestyle factors that we have to look at. And for the Cancer Society, October is a very, very important month for us, as this is our Breast Cancer Awareness Month. And I don't know if you heard the interview that was done for the opening of Breast Cancer Month by one of our oncologists, Dr. Yakab. For 2020 alone, he has already seen 20 new breast cancer patients. This number has actually exceeded our national average of the amount of persons in a year. So it can be said that the statistics given by the American Cancer Society, that 30% more of women will get breast cancer by the end of this year. And this is something that we have to raise the education, we have to raise the awareness, and we need to make women aware of breast cancer and the types of breast cancer out there. And you can simply start doing your breast checks every month. Make sure you're taking charge of your health, you are empowering yourself. Don't wait until you feel a lump or you see breast changes or you have the scarring or the dimpling. Make sure that you're doing early checks, and if you see something abnormal, contact your doctor.
So, what are some of the signs and symptoms we should look for?
Yes, some of the signs and symptoms for breast cancer is that you develop lumps. Some women find it very hard to lift the arm. You have the lymph nodes that are extremely swollen. Some women have a discharge in the nipple. Some start with a rash, a skin rash. Some start with just the dimpling, that you press the breast and the skin literally goes inside. It's very dense, right? So everybody has different signs and symptoms. There is no woman that have the exact signs and symptoms, and you have some women that simply have no symptoms, right? But it is just that they have felt the changes. Sometimes the breasts feel heavy, and there is a breast cancer called inflammatory breast cancer, where the breast grows. So sometimes the young girls feel like, I'm getting bustier and my breast is getting voluptuous, but it is actually a cancer. So these are the type of information that we want to get out there to our young people. We want to empower our women to make sure that you start taking charge of your health. And we want you to know that there is survival after breast cancer too. We have a very high survival rate in the country of Belize and in the world. It is one of the cancers that we're able to get over.
Is there a specific diet you should maintain when you are diagnosed with breast cancer?
Well, for breast cancer, it is just like many of the other NCDs and diseases. For breast cancer, we encourage you to eat more green leafy vegetables, to eat food with less fat, less sugars, because the cancer has been linked to sugars as well. And we eat a lot of these carbonated food, we eat a lot of these genetically modified products, we eat a lot of canned stuff, we eat a lot of packaged foods. And these foods are not as healthy as we think. Even though they are claiming to be healthy, they're not as healthy as we think. So for the breast cancer patient or the person that has breast cancer in their family or just living that healthy lifestyle to avoid developing breast cancer, we urge you, it's the same recommendation. Eat healthy, eat a wide range of your or food groups that we have. Eat lean meats, green leafy vegetables, have your staples, make sure you're eating your fruits, and most importantly, drink water. We do not drink water. We consume a lot of juices, we consume a lot of ideas, we consume a lot of beverages that hold a lot of sugar. And sugar is linked to the development of cancers, especially breast cancers in your body.
Okay. My other question to you, does the type of feminine product we use has anything to do with breast cancer?
Well, there has not been any scientific link to say that breast cancer has been linked to maybe deodorant use or the parabens in different types of fragrances or your body splash. But these are things that we also have to make sure that we're aware, because there's a lot of myths out there about breast cancer, that if you use this particular deodorant or you use hair dye in your hair, you will get breast cancer. These things are myths, so we have to make sure that we're getting the correct information. Breast cancer has different risk factors that elevate it, meaning like maybe some estrogen and their hormones. Many of these products, it has not been tested and proven that these products are linked to the increase in breast cancer. So we'd like to get that out there and tell people, make sure you research, get your information, read up about it, but no, your feminine products will not give you breast cancer. There has been some cancers like endometrial ovarian cancers, which has been linked to talcum powder, which is baby powder, but not for breast cancers.
My final question to you, Ms. Heather. After a treatment, is there what are the risks of the occurrence of breast cancer?
Well, the risk for the occurrence of breast cancer is low for many, but however, after breast cancer, that risk increases just like any other cancers. If you continue to maintain unhealthy diets. Another great risk is obesity for women having recurrent breast cancer. It is found that breast cancer is normally reoccurring women in that age 60, 50 above. However, we are finding the recurrence coming more in women that are obese, and this is international data. And it is something that we're seeing in our country as well, because as you know, Belize has a very high obesity rate, more among our women and children than our men. But we have to put it out there that men get breast cancer too. We have had men that have had breast cancer, and for them it is 10 times more serious than a woman because they do not have that fatty tissue to hold the lung. So we urge our men and our women for Breast Cancer Awareness Month, please make sure you're doing your self-check. If you've identified any lump or any abnormal changes, be sure to contact your doctor. A simple breast x-ray, a simple mammogram could see a lump or save your life before you even feel it. But make sure that you understand how your body works. That's the only way you will know if changes occur. And that is how a lot of people find cancer in the early stage. But unfortunately, with the obesity, a lot of our women are presenting in the late stage because the extra fatty tissue makes it very hard for a woman to find that lump. And sometimes, by the time our women present, it is metastatic breast cancer, which is a stage 4, which is a few people survive a stage 4 breast cancer. But many people, it's just palliative chemo, it's palliative care, and end-of-life care to ensure that you have that dignity, because there's not much that can be done at the metastatic stage, because that means that the cancer has left the breast and has spread to other organs in the body. And this is done through the bloodstream. Once the cancer gets into the blood and the lymph node, it has the ability to spread. So the earlier you catch a breast cancer, the earlier you catch any cancer, the survival rate will be 10 times higher.
Thank you, Ms. Heather, for having this interview with us. Greatly appreciate it.
Thank you for having the Cancer Society spread this education and get out there, because especially with this COVID time, it's very hard for us. We're not able to do community education, but that does not mean cancer stops. We still have a lot of women and men coming in, especially a lot of children. And the issue of cancer is something that is becoming more and more burdensome for the country. We're having more people infected. The finances are very limited for treatment and for access to care. So the best method is prevention. We have to try to prevent these diseases before it comes to the point of treatment, because as a country we do not have the money to continue to pay for cancer treatment. And for the breast cancer person that is diagnosed, it is very scary, because you get a diagnosis today and you have to think about maybe finding $15,000 to $20,000 to complete a treatment. Then suppose you need radiation, suppose you need to do a breast removal. So it is a very serious scenario for many families. Sometimes it puts them into economic downfall. A lot of families lose their homes, lose their vehicles, just to try to pay for medical bills. So we have to get this message out there, and we applaud you guys for doing this, especially for the young people. You have to stress, don't only say that breast cancer happens when women 40 and above. We have a lot of women with breast cancer in their 20s. We have lost women this year with breast cancer in their early 30s that are stage 4. So cancer is real, and we urge you, please do your checks. Practice your self-breast examination and get the education and share it with a friend.
Okay, thank you.